is that doctor. I am just sitting here getting so old and this gosh darn thing hurts so bad. Please get them.
I know, Mom. It's almost 9, so hopefully the doctor...
I'm gonna have to be in bed soon. Saka! Hello? I can hear you.
How are you?
No, I can hear you. I'm good. I'm tired of sitting in this bed. This hurts.
It's been a busy night.
No, you can talk to me normal.
Tell me about what happened.
My dang grandkids just leave their stuff everywhere. And it is so hard for us little old ladies to be walking around our home with toys all over the place. But this hurts and I need it to be fixed.
Well, first of all, have your grandkids pack up after themselves a little bit better. And secondly, let's take a look at this cut. Soap and water and pat it dry. Any questions?
Can you say that one more time?
Soap and water and pat it dry. And a Band-Aid on top.
Did you get that?
Yes, I can help you with it.
Please.
Any questions?
No.
Well, I'm sure you're ready to get home, Miss Saka.
Yes.
I'll get the nurse
I
right
need
in
my
to
cats.
get your discharge papers.
Thank you.
Bye.
Finally, somebody comes in here and tells me what to do about this wound. Who is it?
Knock, knock. Hi there, my name's Lydia. I'm one of the nurses.
Nice to
This is
meet you,
Emily.
sweetheart.
She's training with us today.
Hello.
Can you just confirm your full name and birthday for me?
It's gonna be Daniela Saka, November 22nd, 1958.
Perfect. All right, so we're just here. We're gonna get you your discharge paperwork and we'll put a bandage on your wound for you.
Please do. I'm so sick of looking at this thing. It is nasty and it just makes me so mad thinking about them grandkids running around with them toys.
I know.
I'm trying. I'm
know.
trying, baby. I'm trying.
Well, I can
We
imagine.
understand you're frustrated. We're gonna help you clean it up and
Please.
So I understand the doctor came in, took a look. Looks like you don't need any stitches, and our tech's got it clean for you.
Yes.
So what Dr. Schultz instructed us was that we're just going to apply a basic bandage, and then we'll go over how often to change that for you. But let's go ahead and get that covered up for you, and then we'll talk about some wound care.
Thank you, sweetheart.
Is this your daughter, or what's your
Yes.
guys' relationship?
I'm Ansley. I'm her daughter.
Good to meet you. Thanks for being here.
She's my best support in this time of need.
I can imagine.
I know, and my daughter's the one that put her in this situation now. So
She's 6 years old and she just has toys everywhere.
Oh yeah.
I love her to death, and as much as I love my daughter, but my God, those things are annoying. And
It's
it
an
gave me
active
this.
age, for sure. Yeah, well, let's get you cleaned up. I brought in an adhesive dressing, and let's see here.
Now, what is this?
So this is something that's going to help keep your wound nice, dry, and clean. With taking care of wounds, it's really important. You don't want to get too wet, but you also don't want it too dry. You kind of want the little Goldilocks in the middle. So
Okay.
we're going to have you keep this covered pretty much at all times until you get some new skin regrowing over that area.
I sure hope that happens soon. How long will I have to wear this for?
Yeah, that's a great question. Everyone heals at slightly different rates. Let's talk about kind of what to look for in just a moment here, but first I want to just talk about kind of cleaning it up and then how to apply this dressing, if that sounds okay to you.
Yes, ma'am.
All right, so we already cleaned you up with some soap and water here, but when you're at home, every time you take off a dressing and you had it like this, you're gonna wanna wash it with some really mild soap water. Don't scrub it, be super gentle, because the skin's really sensitive.
So I
right?
can't use any of my Bath and Body Works soaps.
I probably wouldn't use anything with scent, just because that's a little hard on the
I
skin.
just got my Christmas candles.
Oh, I bet they smell good.
The soaps are amazing.
Yeah. Do you have some neutral, like unscented soap you might be able to
My
use?
daughter will get me some.
Okay, great. So this is, you can see in the middle here, it's a little bit shiny, and that means it's a non-stick bandage. So when you take this off, it will be really neutral and it won't pull the skin off.
Okay.
So when you're buying bandages at the store, you're gonna wanna look for things like non-stick, and there's instructions in your discharge paperwork we'll go over with you as well. So this looks like it's gonna be a great size. So we'll get this nice and smooth right over your arm here. We're just gonna put the non-stick part right over your wound.
Ooh, that's tender,
I
honey.
apologize. I'll do my best to be gentle here. And we're gonna kind of smooth outward so you don't get as many wrinkles. just get it nice and covered. Already looks a lot better, right?
Feels so much better.
Good.
It's finally covered up like you wanted it.
Thank
Perfect.
God.
And that's really all you need to do to keep it covered. This is a little bit breathable, so it's going to keep it in that nice middle, not too wet, not too dry stage. Any questions about how to get that on your arm?
Well, if I don't remember, my daughter sure does, so
Okay.
I think we'll manage.
And sometimes you saw how I use both hands. It can be a little bit hard to put things on your own arm, so I don't know if you'll be around and maybe be able to help her
Yeah.
get that on during dressing changes.
I'll definitely be able to come over and help her cover it and do it because that would
That's
be
great.
hard to put on with one hand.
Yeah. So let's talk a little bit about how long this is going to be on your arm, like you were asking about. So you're going to want to keep it covered and basically until skin regrows over the wound. If you're having oozing, things like that,
Well,
you're
how am
gonna,
I going to know that if it's covered?
that's a great question. So we're going to have you periodically, every once in a while, change this dressing. So pretty much if
Okay.
you shower and it gets wet, you're going to change it. If
Okay.
it's visibly dirty, get some dishwaters, you're out hiking with the kids, change it if it's dirty.
Girl, these hips
Um,
don't hike anymore.
yeah.
You're so funny.
But, but pretty much at a minimum every 3 days, okay?
Okay.
So you're probably gonna end up changing it maybe once a day if you're showering daily and things like that. You can kind of, at the end of your shower, clean it with your soap and water, put on a new dress in. And then each time you have it open, just take a look, and Emily can talk a little bit about what to look out for in terms of wound healing and infection.
Yes. So every time that you do change it, you just keep an eye on it. You want to look for any redness around the wound. Like pink is okay, but if it gets red or looks inflamed, that's a sign of infection. Also, any extra drainage that you see happening that's different, that's another sign. And if you get fevers or chills, that's a sign to call your provider
Okay.
because that could be another sign of infection. and you don't want
I
it to
get pretty
worse.
cold all the time though. Am I gonna be okay?
Different kind of chills. When you feel like when you feel sick and you get the chills.
Yes, ma'am.
That kind of chill.
Okay.
And what color will the drainage be if it's
It should-
infected?
Oh, infected, it will have more greenish yellow. You want it to be more clear.
Okay.
In this first day, you'll probably have a little bit of blood and maybe even a little bit of yellow stuff on your dressing, and that's okay. But in the next few days, if that's still really yellow or changing to green, or it is really painful, or you're getting red streaks, that's when we want you to give us a call and we'll advise you as necessary.
And so the doctor said to wash it with water and soap. So do we just do that every time she takes the dressing off?
Correct. Yeah.
Okay.
Any other questions you guys have about how to take care of this?
Honey,
I think we're okay.
I think we're good.
Alright, so I've got your discharge paperwork here. We've got everything typed up we just said.
Perfect.
And you can look here, kind of just goes through everything. Do you want to just repeat back to me just so I make sure you've got everything, kind of how you're going to take care of this for at least the next few days here?
We're gonna make sure that it's not too wet, not too dry, just like Goldilocks, just like you said. And my daughter's gonna change it for me every couple of days or when I get it wet. But I do not shower, I only take baths.
Oh, lovely.
Thank you. Well, that'll be it for us. I'm ready to leave.
That sounds good. We'll get you out of here.
Are you guys gonna send the bandages with us, or
Yes,
do we need
we've
to
left
get
some
around?
extra ones here for you.
Okay.
And if you need more, they're easy to find.
Okay, we'll put together a little bag for you and we'll be back out and then we'll walk you out to registration.
Okay. And do we need to do like a follow-up appointment just to check on it at all, or just only if it gets infected? Make sure we come in.
Dr. Schultz didn't have any mandatory follow-up. This should heal up on its own. But like we said, if you're developing any symptoms, signs of infection, that fever, then give us a call and we can certainly fit you in and we'd be happy to see you.
Thank you, darlings.
Yeah, it was nice meeting you. I hope you heal up and
Happy healing.
enjoy time with your grandkids.
Thank
I sure will.
All right.
Hello?
Hi, Miss Saka.
Honey, I went to pick up my cat the other day and he got on my wound. Can you please check it? I'm so sorry.
Well, I'm glad you're back, but I also hate to see you back, okay? But let me take a quick look at it, okay?
I couldn't remember what it meant, if it was infected or not. And my cats, they are indoor outdoor cats, and they just go everywhere.
They sound like little mischief makers, that's for sure. Okay.
Sir Flufferton's is the absolute mischief
Well,
one.
Miss Sako, let me ask you a couple questions. Are you feeling any pain or tenderness in the area?
No,
Okay. Do you
No.
feel warm?
no,
Notice any streaking up in your arm?
no. My daughter's done a great job of changing that bandage and
Okay.
everything. I just got so scared because the cat touched it.
Look, this might hurt a little bit, okay?
Okay.
Pull your hair a little bit, but let me just take a look.
Oh, you're so gentle. You're
Well,
so
I
kind.
sure try, sweetie.
How's it looking?
It looks beautiful. I don't think your cat did any damage, all right? So you just keep on snuggling that kitty. You keep doing
Okay.
what you're doing. Are you washing it out with a mild soap and water?
I got the soap just like the doctor and that lovely nurse told me.
Okay.
I'm not using my Bath and Body Works scented soaps.
Okay.
I just got so nervous.
All right. Well, we are here for you anytime you get nervous. And you know what? If in the future, if you want to just give us a phone call, you're welcome to do that. We're here for you.
Thank you, sweetheart.
You're welcome.
May God bless you.
God bless you.
Thank you.